Good evening. Thank you for joining us tonight for our 18 News digital exclusive State of the Virus. I'm George Stockberger. Now, today we're answering your questions regarding COVID-19 and the vaccines as distribution continues across the country. And today we're joined by Dr. Michael Scalzone, the Chief Quality Officer for Guthrie. And thank you for joining us once again, Doctor.
Thank you, George.
All right, so Dr. Scalzone, looking at the numbers every day here in our area, it appears that the cases seem to be improving and coming off of that holiday surge that we saw. The governor says that we are on the other side of that holiday curve, but there is, of course, still work to be done. What are you seeing inside the hospital with the cases?
So we're seeing that same trend, and it's really gratifying to be able to see that. As you know, our hospitals were very stressed a number of weeks ago, including a number of people that were very, very ill. And as these last weeks have gone, we're seeing slowly decreasing number of people to the hospital. When we look at the state data, we can see that in our region, there's starting to be fewer and fewer admissions across the region. And so as we look forward, we always try to predict a few weeks ahead. We're very reassured that things do seem to be on the other side of the hill.
All right, and some more good news that we've been tracking. Chemung County has gone about 2 weeks without a COVID-19 death. Steuben County has had some deaths, but none of them have been in nursing homes since the beginning of the month. In Schuyler County, they have not had a death since December. Is this a product of a vaccine doing its job?
You know, that's a great question. We don't think it's the vaccine yet. So if you recall, the vaccine is 2 doses, and they are spaced either 3 or 4 weeks apart. And it takes a week or two even after that second vaccine to have full immunity from it. So we don't think it's the vaccine yet. I think there's 2 parts of it. We have gotten better at understanding how to isolate potentially ill people inside a nursing home. And I think our treatments have advanced. So since the spring, we really have learned a lot about this difficult disease and how to better treat people when they do get to the hospital.
All right, now we've gotten a lot of questions about the vaccine and how to register. Both Joyce and Joseph asked, where can seniors register to get the COVID-19 vaccine?
This has been such an interesting time as the state and we as healthcare systems have tried to distribute the vaccine as widely as possible. It's brand new for everyone. It's been a little complicated, but right now, the method to get an appointment for a vaccine remains through the state website. You check your eligibility on the website. There's a scheduling function. It shows you where vaccine sites are available, and then you can put in your information, make sure that you're eligible, and certainly elderly folks are, and then they can make an appointment at their convenience. We know that this has been difficult and that the available slots really do get filled up within hours or sometimes minutes. And until we get a larger supply of vaccine, I'm afraid that's what's probably going to happen. But that's the method of how you get an appointment to be vaccinated.
All right, and with people already getting the first dose of the vaccine, some will have to get 2 shots. Michelle in Tyrone says she's already gotten her first dose, but she's worried that due to the supply issues that we've seen, that she won't be able to get her second shot. So what is the plan for people to get that second shot and to make sure that we have that supply available?
So I really want to reassure people. We are fully convinced that the second dose will come and that those doses are available. And that's what our experience has been. So we are now in a situation where we've given second doses to our phase 1A priority people, the healthcare workers, and those community healthcare workers like emergency services and individuals like that. And we have not seen any problem with that second dose supply coming. So I'm very confident that that's going to be available for people, and it's going to be available for those people in the right time frame to be fully effective.
All right, that's great news. Now, we've heard about, of course, the UK strain. We've talked about that a little bit, but earlier this week, the governor talked about a South African and a Brazilian strain. So what are these new strains and how are they evolving here during this coronavirus period?
Sure. So viruses evolve, and we've talked about this a little bit before, that this virus, like many, slowly evolves over time. What matters is how significant those changes are. And those changes can impact a number of different characteristics about the virus. We have learned that some of these changes, like the UK change, does increase the chance of transmitting the virus. It is more infectious. But one of the things we know is that it does not seem to cause more severe disease. And so that's very reassuring. We also know that for each of these different strains, right now, we feel very comfortable that the medications that we use and the vaccine that's been developed will be effective for them. Obviously, that's something we have to continue to track. It's only a small number of people that have had these different strains yet, so we don't know that for sure. But we're optimistic at this point that the virus will be changing, but our vaccines are still going to be effective.
All right, and just speaking about the vaccine, Ms. Strain, Sarah in Hornell asked about the vaccine and will it protect us against these strains, and you're saying yes, it will.
I am. The UK strain we feel very comfortable with. We've had enough experience with that, or the world has had enough experience with that, to be very confident that's the case. The South African strain seems to have more changes, and so we're still investigating that. But I don't want people to hesitate to be vaccinated because of the risk of these strains. It still is very important to make sure that they get that vaccine when it's available for them.
All right, doctor, of course, we've heard a lot of rumors about the vaccine. Two of the ones that I've heard concern fertility and breastfeeding. Does the vaccine affect anyone's fertility? And what do we know about the safety with mothers and newborns when it comes to breastfeeding after the mother receives the vaccine?
So breastfeeding, as you know, we think is incredibly important. It's very healthy. It is the best way to feed your baby. I've been an obstetrician for 30 years, and breastfeeding is wonderful for both mom and baby. There's no evidence that the vaccine can be found in breast milk. So we are confident that it is safe to continue to breastfeed, and the vaccine should not be a concern for that. There's also no evidence that it impacts fertility. I know that there have been some rumors out there. There's been some theoretical concerns, but really the science does not prove that out. We don't believe that there's any risk of fertility with using this vaccine. And we've not had other vaccines where that's been a problem. So again, I don't think either of these reasons should prevent women from being vaccinated.
All right, and if someone's currently on an antibiotic, such as a Z-Pak, will they be able to get the vaccine, or are they going to have to wait as well?
No, absolutely. They can get the vaccine right now. There are very few reasons that someone can't get the vaccine at any time. Really, the only reason right now that we would have someone delay is if they were acutely infected with coronavirus and still in their quarantine period.
All right, and what do we know about people who have received organ transplants? Will they have any issues with the vaccine if they've received a kidney or a liver through a transplant?
These people are generally immunocompromised. They're on medications that impact their immune system and make them at a higher risk of infection. So they are actually in a category of people that we want to be vaccinated earlier rather than later. So right now we believe it's safe and would encourage that to happen. Of course, it's a serious illness and they should check with their own physician prior to them.
All right, doctor, this week President Biden has promised to issue a national mask mandate. So what can we expect to see from that, and what effect do you think it'll have against the spread of COVID?
Well, it's been very interesting. Typically, this time of year, we have a lot of people hospitalized for the flu. And that has been very, very rare, very uncommon across the entire state of New York. Typically, there would be 1,000 to 2,000 individuals hospitalized for the flu right now. And this year, it's in the 10s and 20s. What that tells us is our current practices of distancing and wearing a mask continues to help, and even for the flu, it decreases the risk of a flu infection. And so a mask will remain important until we can get a large part of the population vaccinated, and until we get the asymptomatic transmission down in the region. We're still going to need that masking, and I hope that having a national policy on that will help.
All right, and continue with the mask question. Donna in Bath asks, why do we have to continue to wear a mask after receiving the vaccine? And adding on to that, what are some other precautions people should continue to follow after they get the vaccine?
So there's two answers to that question. The first is these vaccines are effective, but no vaccine is 100% effective. And so right now, the two vaccines that are approved for emergency use authorization in the US are about 95% effective, which means that there's a 5% chance that you could still be infected and become ill with coronavirus. The second part is we are still learning about whether there is a risk of transmitting the virus, even if you're protected by the vaccine. So it's possible, theoretically, that if you're exposed to the vaccine, the virus, even if you've been vaccinated, you may carry that for a short period of time and be able to infect someone else. We don't have that answer yet, but that's a good reason to continue wearing the mask until we can better understand that.
All right, and of course, we have the Pfizer and Moderna vaccines. We're expecting to get the Johnson & Johnson and the AstraZeneca vaccines in a couple of weeks. So what do we know about these vaccines, and how are they going to be different from the first two that have already come out?
So there are a couple of really important differences. The first is that the Pfizer and the Moderna vaccines are RNA vaccines. These two vaccines, both the Johnson & Johnson and the AstraZeneca, contain a harmless virus that's been altered for the spike protein so that they can produce antibodies to the spike protein of the coronavirus. So the technology is slightly different. This is a very traditional technology. This is the way many vaccines have been developed over the years. And so although it's a slightly different technology, we do believe they'll continue to be effective. Right now, the effectiveness for the AstraZeneca vaccine is felt to be in the 65% range. So not quite as high, but still very effective. About as effective as the typical flu vaccine is. As far as the Johnson & Johnson vaccine goes, we don't know that effectiveness just yet, but one of the advantages of the J&J vaccine is that it's designed to be a one-shot vaccine. And so that helps from logistics. That helps that people just simply don't have to come back twice or have two shots. And hopefully that will help the distribution and just the increased supply of vaccine over time.
All right, Doctor, I'd like to get some final thoughts from you. What do you need the public to know most right now, especially when it comes to the vaccine?
So I really want to make sure people understand and believe that this is a safe and effective vaccine. And we really are beginning to make progress here. The rate of people being hospitalized is coming down. The number of people with severe illness is coming down. We're starting to get the vaccine out to individuals, and we just have to, for the next couple of months, continue to be cautious. We really are making strides in the right direction, and hopefully we can move back towards a more normal time frame if we continue to wear a mask and continue to avoid large groups. And I really encourage everyone to get vaccinated when their time comes.
All right, great advice, Dr. Scalzone. Thank you for joining us today. And viewers, if you have a question regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. Thank you for joining us and have a good night.